Ignoring your prostate? Big mistake, man. In today's video, we're diving deep into one of the most important but often overlooked aspects of men's health, the prostate. Whether you're in your 40s, 50s, or beyond, this presentation will equip you with the insights, tools, and strategies to maintain optimal prostate health and reduce your risk of the disease. So let's get started. The prostate is a small but powerful gland, about the size of a walnut, and it sits just below the bladder and in front of the rectum. It wraps around the upper part of the urethra, the tube that carries urine and semen out of the body. Its primary job is to produce seminal fluid, a nutrient-rich liquid that mixes with sperm from the testicles to form semen. This fluid protects the sperm and helps it move more effectively through the female reproductive system. But the prostate doesn't just contribute to fertility. It also plays a role in hormone metabolism, particularly by converting testosterone into a more potent form called dihydrotestosterone, or DHT. While this is essential for male development, it can also contribute to prostate enlargement later in life. As men age, the prostate often grows, and while this isn't always a problem, it can cause urinary symptoms if it presses against the urethra. That's why understanding the small gland is so crucial for long-term health, comfort, and function. There are three major conditions that can affect the prostate. Number one, benign prostatic hyperplasia, or BPH, prostatitis, and prostate cancer. We will explore each one, their symptoms, and how to address them. BPH, or benign prostatic hyperplasia, is a non-cancerous enlargement of the prostate that affects most men as they age. It causes symptoms like frequent urination, weak stream, and nighttime trip to the bathroom. Prostatitis is inflammation of the prostate, sometimes due to infection. It can cause painful urination, pelvic pain, and flu-like symptoms. Treatment often includes antibiotics and anti-inflammatory. Prostate cancer is the most common cancer among men, second only to skin cancer. But here's the encouraging news. When detected early, prostate cancer is one of the most treatable and survivable cancers. The prostate is a small walnut-shaped gland in men that produces seminal fluid. As men age, changes in this gland are common, but not all of them are cancerous. Prostate cancer typically grows slowly, and in many cases, it doesn't cause symptoms in its earliest stages. That's why regular screening can be a lifesaver. The two most common ways to screen are the PSA blood test, which measures prostate-specific antigen levels, and the digital rectal exam, where your doctor checks for abnormalities. Risk increases with age, especially after 50. African men and those with a family history are at higher risk. So what are the warning signs? In more advanced stages, prostate cancer can cause difficulty urinating, weak or interrupted urine flow, blood in urine or semen, pain in the back, hips, or pelvis. But remember, many men have no symptoms at all until the disease progresses. Treatment options vary from active surveillance to surgery, radiations, and hormone therapy, depending on the stage and aggressiveness of the cancer. The key message is early detection saves lives. Talk to your doctor about whether screening is right for you, especially if you're over 50 or have risk factors. Let's raise awareness, break the stigma, and help more men catch it early. Risk factors include being over 50, African American, having a family history, and eating a diet high in fat or low in vegetables. Most early stage prostate cancers don't cause symptoms, but if they do, they may include trouble urinating, blood in semen, and bone pain. Screening involves the PSA blood test and a digital rectal exam. PSA, which stands for prostate specific antigen, elevated level could mean cancer, but also other conditions like BPH and prostatitis. Normal PSA level vary by age. A high PSA doesn't always mean cancer. Your doctor will consider your overall health trend over time and possibly recommend a biopsy. So if you have been diagnosed with prostate cancer, the road ahead may feel uncertain. But there's good news. You have options. Prostate cancer isn't one size fits all, and neither is the treatment. The best choice depends on your cancer stage, how aggressive it is, your overall health, and just as importantly, your personal preferences and goals. Let's break it down. Active surveillance. For slow-growing cancer, especially in older men and those with other health conditions, your doctor might recommend watchful waiting. This means regular PSA tests, digital rectal exams, and possibly biopsies without immediate treatment. It's about balancing safety with quality of life. Surgical removal of the prostate is called a radical prostatectomy, is a common treatment for localized cancer. It can be done through traditional or minimally invasive robotic assisted methods. Risks include incontinence and erectile dysfunction, but for many, it offers peace of mind through complete removal. Radiation therapy, this can be done externally using a machine that targets cancer cells or internally through brachytherapy, which implants radioactive seeds in the prostate. Radiation can be as effective as surgery, especially in early stage cancers. Hormone therapy, since prostate cancer often depends on testosterone to grow, androgen deprivation therapy, ADT, can slow or shrink the tumor. It's often used for advanced cancers or combined with radiation for high-risk cases. Side effects may include hot flashes, mood changes, or reduced libido, but it can be life-extending. Chemotherapy, while not typically the first-line treatment for early prostate cancer, chemotherapy is reserved for advanced or resistant cases, especially when hormone therapy stops working. It works systematically to kill fast-growing cells and can help improve survival and reduce symptoms. So how do you choose? This is where your care team becomes crucial. You will weigh the risks and the benefits, cancer aggressiveness, side effects, and most importantly, your personal values. Some men prioritize longevity, others quality of life, and many want a plan that balances both. So the takeaway is prostate cancer treatment is not one size fits all. With early detection and the right strategy, the outcome can be excellent. Talk with your doctor, ask questions, and make a plan that's right for you. Prostate cancer treatments are powerful and potentially life-saving. Some men prioritize longevity, others quality of life, and many want a plan that balances both. So the takeaway is prostate cancer treatment is not one size fits all. With early detection and the right strategy, the outcome can be excellent. Talk with your doctor, ask questions, and make a plan that's right for you. Prostate cancer treatments are powerful and potentially life-saving, but they can also come with real side effects that affects daily quality of life. So understanding these side effects helps you plan, prepare, and take control. Let's walk through the most common ones. Urinary incontinence. After surgery or radiation, some men experience urine leakage, especially during activities like coughing, sneezing, or exercising. It's often temporary, but in some cases it may persist. Pelvic floor therapy and incontinence products can help. Erectile dysfunction. This is one of the most feared side effects, and for good reason. Nerve damage during surgery or radiation can affect sexual function. Medications, vacuum devices, even penile implant can support recovery. And remember, sexual health is valid and important topics to bring up with your doctor. Fatigue. Radiation and hormone therapy in particular can drain your energy. The fatigue can feel different from everyday tiredness, more like a persistent lack of stamina. Balanced nutrition, exercise, and rest routines can help rebuild strength over time. Hormonal changes. Hormone therapy lowers testosterone, which can lead to hot flashes, weight gain, mood swings, reduced muscle mass, loss of libido. These changes can be physically and emotionally challenging. It's crucial to monitor and support your hormone health throughout treatment. Emotional health. Depression, anxiety, and mood shifts are not uncommon, especially when navigating the changes to your body, relationships, or sense of self. Support groups, counseling, and open conversations can make a big difference. Cognitive effects. Some men report brain fog, trouble concentrating, or memory issues, especially during hormone or chemotherapy. Staying mentally active, getting enough sleep, and reducing inflammation through lifestyle changes can help protect brain health. What can you do? First, ask your provider about potential side effects before starting treatment. Second, create a plan to minimize or manage them, from pelvic floor therapy to mental health support. Third, know the side effects don't mean suffering in silence. There are tools, therapies, and communities ready to support. Prostate cancer treatment is a journey not just to survival, but to recovery and thriving. Your voice, your questions, and your comfort matter. When it comes to prostate health, your daily habits are some of the most powerful tools. The science is clear. Small lifestyle changes can reduce your risk of prostate issues, including benign prostate enlargement, inflammation, and even cancer. So let's walk through what works. A Mediterranean-style diet is one of the best models for prostate health. Move your body regularly. Exercise doesn't just keep your weight in check, it lowers inflammation, boosts testosterone balance, and improve circulation. Aim for 150 minutes per week of moderate activity like walking, biking, or swimming. Resistance training 2 to 3 times per week to maintain muscle and metabolism. Studies show that men who exercise consistently have better prostate outcomes and recover faster from treatment. Maintain a healthy weight. Obesity increases the risk of more aggressive prostate cancer and urinary symptoms. Fat tissue, especially belly fat, produces hormones that can drive inflammation and cancer growth. Even a 5 to 10% weight loss can make a big impact on hormonal balance and inflammation levels. Reduces chronic stress. High stress over time raises cortisol and inflammation markers that may worsen prostate health. Stress also affects sleep, immunity, and testosterone, all of which are tied to prostate function. Consider meditation, deep breathing, time in nature, regular downtime. Every 10 minutes, even 10 minutes a day of focused stress relief can make a difference. So what's the bottom line? Stay lean, move often, eat smart, breathe deeply. These simple lifestyle shifts don't just help your prostate, they protect your heart, brain, hormones, and overall longevity. You don't need a perfect plan, just a consistent one. Your prostate and your future self will thank you. Here are some key questions to bring to your next appointment. What is my PSA level and what does it mean? Do I need a prostate biopsy? What are my treatment options and their side effects? Now let's bust some few myths. Only older men get prostate cancer. In fact, it can occur in men in their 40s or 50s. All prostate issues mean cancer. Many are benign and manageable. We often hear the word longevity and think about living longer, but what really matters is health span, the number of years you feel strong, independent, and fully yourself. Your prostate health plays a surprisingly big role in that equation. So let's break it down. First, your prostate is about the size of a walnut, but it has oversized influence on your quality of life as you age. When it's healthy, you're more likely to enjoy better urinary control, no leaks, urgency, or nighttime bathroom trips, sexual health and confidence, including erectile quality and ejaculation, fewer complications like infections, inflammations, or cancers. But when prostate issues strike, whether it's enlargement, inflammation, or cancer, they can chip away at your energy, comfort, and self-esteem. And those effects ripple out to sleep disruptions from frequent urination, anxiety around intimacy, reduced activity level, emotional stress, or depressions, all of which shorten your health span, even if your lifespan continues. Inflammation and hormonal shifts linked to poor prostate health can also accelerate aging in other systems like cardiovascular health and brain function. That's why protecting your prostate isn't just about avoiding cancer, it's about preserving freedom, function, and fulfillment as you age. So what can you do? Get regular checkup, eat anti-inflammatory foods, stay lean and active. Don't ignore early symptoms. Most importantly, see your prostate as a critical part of your longevity strategy. Because a healthy prostate supports a longer, stronger, more vibrant life. This small gland can have a big impact on how you live later in life. Here's your takeaway. Know your risk. Get screened appropriately. Eat clean. Move daily. Stress less. Ask questions. Stay informed. You now have the knowledge and tools to take charge of your prostate health. Don't wait for symptoms. Be proactive because you deserve to age with strength, vitality, and confidence. If you found this helpful, give this video a thumbs up, subscribe, and share it with someone you care about. And most importantly, book that prostate check. Your future self will thank you.
Please don't forget to like, comment, share, and subscribe.